welcome a special guest for the first time on my Instagram. I'm interviewing someone, so it's kind of exciting. But this is Michael Sudbury. Is that how I pronounce your name?
Sudbury. There's no N in there.
Sudbury. Ugh, gosh. Okay, I added
And
that.
lots of people do that.
I'm so sorry. Very talented massage therapist who owns Release Works of Salt Lake City. And I wanted to kind of talk a little bit about my experience in finding you all, you and the other therapists at Release Works, and kind of like what my experience was like. And then I'd like you to talk about you and your experience and that kind of thing.
Sure, happy to do it. Thanks for having me.
Okay, thank you. So for the last, I don't know, 4 or 5 months, I've been experiencing chronic pain in my low back and into my hip. And this is something that I've dealt with in the past and have since naturopathic school and thought it would just pass. So, like everything, everybody, even patients I see, and I tell them not to do this, I just sort of like let it go. And I was like stretching and working out and just kind of, doing basic self care. And finally, I decided I've had enough. I went in for some acupuncture. I saw a physical therapist. I worked with my trainer. I did all kinds of stretching, YouTube videos, ice, hot, topicals, whatever, and nothing was really helping. And then I thought to myself, I need to find a myofascial massage therapist, not really, I mean, knowing what it was on some level, but not really knowing. And the pain just got to the point where I called. I left a voicemail one Friday night, and you all called me back, um, and I started. That was at the beginning of February. Um, and ever since then, have been seeing you on. It's really helped me get to a point where my pain isn't so much the focus. It's more getting my body back to like really healthy working order. And it's really neat because it's a type of therapy that, in my experience, was able to touch pain that nothing else was. I could take an Advil and then not be in pain for 4 hours and then it would come back. Or I could stretch or I could work out and temporarily it would be gone, but it would always come back. And so working with you all has been a huge educational experience, especially for me as a healthcare provider, but also for me just as a person, in improving my quality of life. So I want to thank you for that.
Of course.
But I really wanted to invite you here to sort of spread the word because I feel like a lot of people could use what you all do, but not a lot of people know that you exist or
Right.
like what it is that you do. So now I'll just kind of like hand it over to you. I'd love to know about maybe your background, how you fell into myofascial therapy, you know, give it.
Sure, sure. What you've been describing is a unfortunately very common story. People get stuck in excuse me, long-term pain patterns for well years, and they just get told they have to accept it. And we think it's just age. But basically, things are getting stuck and tissues aren't moving quite the way they should, which is causing distortions in other areas of the body. Joints get twisted or compressed and start having problems. Nerves get impinged or pulled somewhere along the way the path they're supposed to glide. Organs even get affected. Muscles that should glide don't, and it all leads up to pain. And I'm still guilty of this. So trust me when I say I know that we all get focused on where it hurts and we think that's the problem. When we go get a scan, we go get imaging and we say, oh, a disc is breaking down or a nerve is being pinched or something like that, or this muscle is chronically tight and there are trigger points. And that's all true. But basically what our approach does is we look at that narrow focus of the symptom and we start looking at the broader picture of what's the environment, what's the situation that led to that symptom, because that spot that hurts or is breaking down is just the result of everything. And as well intentioned as everybody's stretching and exercising is, foam rolling and all that, it's usually targeted at the wrong place, and it's usually too aggressive and too forceful to cause the type of change that your body will allow on the deep, troubled areas that are being protected. Way too common a story. Um, and I know you asked, how did I get into this? Complete luck, basically. I actually had been 4 years into electrical engineering in college.
Wow.
When part of me just said, no, I don't want to. Not that I couldn't, it's that some part of me knew that if I continued that direction, I'd be missing something critical to what I wanted in my life. I'd be one of those people stuck in terrible back pain and headaches by now. And instead, I found my way through. Luckily, I stumbled upon a little bit of myofascial release work being demonstrated by my brother, who learned a little bit and doesn't practice, but learned just enough to show me.
Cool.
On my wife, who's had many problems with her whiplash and concussions, and what he described he was feeling and what she described she was feeling, right there at a spot where I had dropped out and I was wondering, what do I want to do? Some part of me went, that I want to do that. And probably like most of us, I thought I was going to be a fantastic, amazing, wild world kind of a therapist, and that was my goal. Turns out, I actually needed all that help for myself. The common theme of the wounded healer was very much true.
Oh yeah, my profession too.
Oh yeah,
Absolutely.
it's like we don't get into this work unless we go through it ourselves.
Yeah.
Yeah. So nutshell, I mean that was 10 or more years ago, and I haven't looked back since. Consumed consumed me ever since.
Yeah, and I think it's really interesting because people, so I have a small, like a short background in massage therapy. I went to massage therapy school when I was in undergrad, and it sort of gave me that um, sense of being with a person when they're vulnerable and being able to like sit with them and when they're in pain, and it transitioned well to my career as a naturopath. And I don't do body work, but it at least gave me kind of like the beginnings into that. And I feel like when I talk to people about getting body work, when we talk about I talk about patients with chronic pain, because honestly most people deal with chronic pain in one form or another at some point in their lives, right?
More than admitted, yeah,
Exactly, yeah. Or they take something for it and they're like, I don't have pain.
I'm fine.
Like,
I can't complain.
exactly. And but when I talk to folks about it, they think of a massage like a relaxation, whatever. When you're in a spa and somebody just sort of like rubs your shoulders and gets into your knots. Um,
Really nice.
Super nice. But
Feels great.
how would you like differentiate what you do from that?
So I have nothing against the Swedish or deep tissue type of massage. It feels great, and it's fantastic at what it does. But it is focusing on chronically overworked, tight, sore muscles. And that's really effective while you're on the table. Feels great when you're not having to deal with gravity. But the moment you stand back up again and get back to what you're doing, those chronically overworked muscles, they had a nice 15-minute break and they're back to 80-hour work weeks, nonstop, basically, back to back shifts. They're overworked again because none of the fundamental issue underlying why they're overworked was ever changed or addressed. So what I mentioned before about the tissues, there are problems that build up in them, and they just plain don't ever get addressed because we're dealing with the results downstream from there. What happens is through long-term stress, injuries, surgeries, what have you, the fascial tissue of our body, which is a completely three-dimensional, completely continuous, everywhere, one-piece bodysuit. It's the fabric of our bodies. It gets gummed up, bound down, adhered, glued, sticky, stiff, dehydrated, dried out, all that kind of stuff, and it doesn't move well. That spot doesn't hurt. That spot doesn't have trigger points, but it causes pulls and distortions in the body. And you can see this really easily. My favorite demonstration is to take my shirt and demonstrate pulled and tight. Now, I won't feel that, but my ribs will be stuck in there. My diaphragm won't move quite right. My neck is getting pulled forward. My shoulder is pulled up, and I'm going to hurt somewhere. Something in all of that is going to be hurting, and that's always the spot that gets rubbed.
Yeah, and I think it's a lot of what I've learned through working with you all is I sort of have to change even my how I learned physiology and anatomy and the layers of the tissue that you can see under a microscope. I've had to sort of open my mind to like there's more than what we are taught, as far as like anatomically. So can you talk more about like what the fascia is?
Sure, sure. Um, I suppose one of the confusing aspects is that in anatomical courses, they do refer to some layers of the connective tissue as fascia, superficial fascia, deep fascia. And so we point at that and go, oh, that must be what we mean. Our usage is a bit broader than that. What we mean is all connective tissue of the body. And that means all the collagen fibers, all the elastin fibers that go form a web of a network web between cells, structure cells into tissues, structure tissues into organs or muscles, and structure all those into a body. So we're talking about the very fibers that weave together our body. All of the spaces in between cells, in muscles, around muscles, in bones, organs, and all that. And even to the point of gluing the skin on top of all of it, and the nerves inside. So that's the fabric of our body, those collagen and elastin fibers. And there's still one more component that we don't even begin to think of most of the time. And that's the fact that that's not empty space in there between those fibers. It's not air, it's not a vacuum. There's actually a fluid in there. We call this fluid the ground substance, meaning the base bottom layer of the whole situation. That, of course, is mostly water, but it's got a bunch of important proteins in there, and most of them, well, at least some of them, are gelatinous, which, yes, that's where we get Jello from. And just like in your fridge, when you mix that up in hot water and set it in your fridge, it sets. In an injury state, in an inflammatory response, your body's tissues, this is the theory, your body's tissues will actually gel and set there with those gelatinous proteins in that fluid. And that reduces metabolic flow, and that gums up the works for those fibers to be able to move and pull, for things to be able to glide. Um, collagen fibers, everybody's aware of that. What they're not aware of is that collagen is the Greek word for glue. And that's where we get glue from, boiling connective tissue. It turns out, I mean, it was horses that were the
The glue factory.
contributors, yeah, but it's connective tissue. We boil connective tissue to get glue, and that's what's going on. So in a proper injury response, our body will glue and stiffen and allow it to protect. And that allows the tissues to repair. But here's the part where we get in trouble. We don't always unglue it once it's done repairing. So that leaves behind at least some amount of what we call restrictions, where the tissues have gotten, that web, that completely continuous fibrous web has gotten gummed and glued. And now it's like a one-piece bodysuit that has shrunk and twisted and glued in the wash. You're still inside of it, trying to fit.
It doesn't work so well.
Causes a lot of problems. And that happens, those problems happen on every layer: organ, nerve, blood vessel, muscle function, joint function, even digestive system and bladder and all that kind of stuff. Sphincters, valves, they're supposed to be round structures that open and close, but if they're pulled through the fascial system into distorted position, they don't open and close so well. Acid reflux, hiatal hernias. There have been quite a few numbers of people I've felt where their esophagus and their diaphragm feel pulled and glued and thickened together. And as we release that, those symptoms do much better.
Yeah.
Tinnitus,
Well,
headache,
and
all of that.
that's an example of, you know, I have so many patients who come to me looking for, a supplement or a lifestyle change that will improve their quality of life. And I'm like, sure, these things could improve it, but if there's something structurally that's not working, we could, throw money at it all day.
Yeah,
But
yeah,
if your body literally is not able to do the thing that you want it to do, it's going to take a whole lot of pushing and shoving and using the, kind of all the models about how the body works that you're talking about. It's more about opening it up. I mean, and your practice is literally called like release works, as
yes.
in we're stuck
Mm-hmm.
and we need to be released in order to allow like normal functioning, right? It's
Our bodies are so good at handling things, and it's sad to me that our society is so focused on the idea of the body as failing, breaking down, doing the wrong thing. It needs to be fixed. In my view, it is absolutely not doing the wrong thing. It is making the best it can of the situation it finds itself stuck in. It's actually the part between your ears that most needs fixing.
yeah. Yep. Mine too. Hmm.
Yeah, and as we learn to trust what the body is doing and follow that more to the source, we do so much better. As we address things that have been stuck upstream, so to speak, all the stuff downstream starts becoming easy to resolve.
Yeah. Yeah, that's so interesting because I mean, just as you're talking, I'm thinking about, oh, yeah, my patient with this, or oh, my family member with that, or oh, yeah, that's been an issue for me. And I would say the most difficult thing for me in my whole process of figuring out, okay, is this pain? Yes, this is pain. What is this pain? People asking me, what is this pain you're experiencing? I'm like, I can't explain it. I think that's been the most difficult part for me is like language around my experience. And I know without a doubt that, so many of my patients have had the same experience. Like, I have this feeling, it's uncomfortable. They haven't been able to see it on an MRI or an x ray, with our like really primitive ways of looking at the body. Um, how how common is it for people to come in to see you to be like, I don't know what's going on, like I have no diagnosis, or is that kind of like a common situation?
It is. I wouldn't say it's more common than somebody saying I have a this diagnosis, but definitely people have come in many times saying so much is going on, I can't figure it out. Nobody can give me an answer.
Yeah.
And I actually kind of prefer it when they don't have one,
Mhm.
almost. Depends on where their mind is. Because the moment we give it a diagnosis, give it a label, we think we know what needs to be done with it. And most of those labels are actually just descriptions of a set of symptoms that are coming out because of the situation your body is in. I don't want to imply that all issues are fascial issues, but you gotta, and many people are wondering, will this help my whatever thing, my whatever pain, my whatever symptom? Not all issues are fascial issues, but you've got to remember that the environment that your body is working in, the environment that your cells, your muscles, your joints are working in, makes a huge difference. The very same office worker, given a twisted, cluttered environment, can't do anywhere near the type of work that a efficiently set up office space can allow. And the fascial system is the environment that's been cluttered and twisted and bound and glued and swampified. That poor office worker or the cells or the joints or the muscles, they don't have much of a chance.
That's a bad working environment.
Yeah, yeah. We talk about toxics and toxins and yeah, it's kind of like a swamp in there for a lot of
Yeah.
people.
Yeah, and I think probably some of the patients that you've seen have been patients who I've seen, which is sort of like I like you were saying, sometimes the diagnosis makes it more difficult. Um, Maybe because we get caught up in the language and the cerebral part of it, and we have to move down to like what's actually occurring.
Yeah.
And what are the things we can do to actually bring you relief, no matter what it's called, no matter what language we've attached to it and labels and what we've become identified with?
And I think people have a hard time with that because we're so focused on the diagnosis as a thing.
Yeah.
But the counterexample, let's say you have a messy room and it's just cluttered and piled full of stuff and it's actually dangerous to go in there and it smells bad. We could call that messy roomitis and give it a label,
Sure.
but we could also just plain get to work and straighten out the room.
Mm-hmm. Yeah, I like that.